This video covers different forms of congenital renal anomalies, and the first condition I would like to talk about is renal agenesis, which is commonly caused by the failure of ureteric bud to develop, and thus, since the body waste fluids of the fetus are not added to the amniotic fluids, these patients will develop oligohydramnios. So the function of the amniotic fluid is to protect the fetus from outside physical pressure. So if there is too little volume in these children, then there would be increased physical pressure, as a consequence of which these patients will develop Potter sequence. So since there is increased physical pressure on these children, there would be facial and limb abnormalities, as well as pulmonary hypoplasia. So these children will die immediately after birth due to respiratory failure. The next condition is horseshoe kidney, which is commonly seen in Turner syndrome, which is XO. So during normal embryonic development, if the ascending kidney gets stuck under the inferior mesenteric artery, it will develop a horseshoe shape. And the function of these kidneys are normal. So it's just that their location that is lower in the abdomen, but the function is normal. The next condition I'm going to talk about is double ureter. And to understand how this works, we will first have to understand the normal embryonic development of the kidney. So during embryonic development, pronephros degenerate while mesonephros make the interim kidneys for the first trimester. And then when they are stimulated by the testosterone, they will develop into male internal genitalia. Metanephros is the main structure that gives rise to the adult kidneys, and it does that by developing into ureteric bud and metanephric blastema. So metanephric blastema gives rise to the Bowman capsule, proximal convoluted tubule, loop of Henle, and distal convoluted tubule. So all these structures from the Bowman capsule to distal convoluted tubule are developed from the metanephric blastema. And from here on, the ureteric bud gives rise to different structures, which would be the collecting duct, renal calyces, renal pelvis, and then the ureter. Now, if there is an early splitting of the ureteric bud, then there would be a double ureter in these patients. So the kidney would develop two ureters that is coming out in these individuals. And just as a reminder again, it's ureteric bud that gives rise to the ureter. So an early splitting of the ureteric bud gives rise to double ureter in these patients. So double ureter is caused by early splitting of ureteric bud. And the final condition is patent urachus. So allantois is the structure that handles body waste fluid during the fetal development. Now, if this allantois fails to get obliterated, then what remains of it during adulthood would be a patent urachus. So this is a patent urachus, which is a remnant of allantois. And so you can see that the bladder is connected to the umbilicus, and thus these patients will develop leakage of urine through the umbilicus. So let's summarize these findings again. So renal agenesis is caused by degeneration of the ureteric bud, as a consequence of which these patients will develop oligohydramnios and Potter sequence. And Potter sequence presents with facial and limb anomalies, and these patients die due to respiratory failure from pulmonary hypoplasia. Horseshoe kidneys is due to the failure of kidneys to ascend during embryonic development, commonly seen with Turner syndrome, in which the kidneys get stuck under the inferior mesenteric artery. Double ureter is caused by early splitting of the ureteric bud. So as a reminder, ureteric bud gives rise to the collecting duct, renal calyx, renal pelvis, and ureter. So early splitting of the ureter bud can lead to the development of double ureter. And the final condition is patent urachus, where due to the failure of allantois to get obliterated, these patients will have leakage of urine through the umbilicus. And that concludes our discussion.